Very good evening to all the members of the Ramaiah Group of Institutions. This is a very auspicious occasion on the World Health Day that we have assembled here for discussion on issues which are really close to our professional and personal selves. So, with this note of introduction to the World Health Day and the eventual proceedings coming through, I request all of you to please stand up for Ramaiah. Now I request the dignitaries of the day to kindly light the lamp and help us to guide this soul event. Success. Thank you so much. Request of Jaina to please chant. Now I request Dr. Veda Rao, Principal and the Ramaiah Medical College, to give a welcome.
Honorable Chairman, Sir, Chief Executive Shri Srinivas, Chief Guest of the evening, Dynamic Dr. Gokula. Thank you, sir, for accepting our invite. Very good afternoon to all of you and a warm welcome. In this event and on the occasion of the World Health Day, at the outset, on behalf of the management and all concerned, I wish to place on record our acknowledgement, profound appreciation, and deep gratitude to all the health workers, administrators, support staff of Ramaiah hospitals for their tireless work and the brilliant service rendered to humanity during the COVID crisis, a sustained effort through the year and continuing efforts in future. And this was possible because of the sincere commitment on the part of our chairman, sir, towards service to humanity, commitment towards education during the pandemic. That was the driving force, and we are all very fortunate to have sir with us as the chairman and a long-standing guidance force. Sir, thank you on everybody's behalf. Our Chief Executive, Shri Srinivas sir, with his unique resilience and his tactful way of getting things done, has been very successfully leading the team to carry out the challenges and face all the challenges during the crisis. On behalf of all the faculty, health workers, sir, thank you for all your support. It's a happy evening for all of us. In the context of appropriately the theme of the World Health Day, which reads as a fairer and healthier world with collaboration. We are here today gathered together to launch one of the endeavors, a collaborative endeavor, the compendium, the COVID compendium. It's a multidisciplinary compendium of COVID current experiences and updates. Why is this so significant? I have cited a few reasons about why this is so special and significant. First and foremost is the laudable effort on the group of contributors. The second is that it's a collaborative effort with contributors from the Center of Global Health, University of Illinois, Center of Global Health for Training, Manitoba University, Canada, and the authors from the Ramaiah campus, institutions of Ramaiah institutions, several authors. Number three, many of the authors have been in the frontline army of people taking care during the crisis. And if they have found time to write down their experiences, I think they deserve to be applauded. It only speaks about their skills to organize their time. And that is a rare skill, not so often easily visible. That's another reason why I think the effort has been absolutely significant. Most academicians believe lifelong learning is a concept which needs to be driven into the minds of all the students. Here is an example where all the faculty who have contributed have demonstrated that they have been in action following the lifelong learning concept, and they have displayed the role model kind of a thing for the young generation. One more reason why they need to be appreciated. Yet another reason why the authors who have worked together under the able leadership of Dr. Krishnamurti. And I don't have to describe the pains he has taken to keep people together and keep the pace going. The other reason is the willingness and enthusiasm of all of them to bring out this book with the sole intention of sharing knowledge and disseminating this very useful knowledge to all concerned. And I have a very strong feeling, and I have gone through it to a certain extent. It's a very good read. And this kind of an enthusiasm is something which is to be again lauded, because in spiritual terms, sharing knowledge is considered a very sacred virtue. And on this note, our hearty congratulations to the leader and the team for bringing out this book. There's yet another aspect of the pandemic. The COVID, with its deep uncertainties, cascading issues on various domains, has also infused an intense stimulus to continue the training and at all levels, not to spare anybody, not just in health sector, but every walk of life. What more can be more beneficial than having developed the app and the platform, which can be a great tool for the purpose of training masses? And that's a credit which goes to Dr. Ranjit for this platform. And then we are all here to acknowledge that. I don't have any intention of stealing their prerogatives to describe the outcome of their efforts. And that said, on this note, let me wish all of you the best of luck in every endeavor. Keep going, enjoy the evening. God bless all of you.
Thank you, ma'am. This unique way of welcoming everybody is always very enthralling. Thank you. Thank you so much. Now we come to the most awaited part of the event today, on the occasion of the World Health Day. It's the unveiling of the compendium. So request the dignitaries to come forward to the stage hereby so that we can ask Diana and his team to unveil the compendium.
Please come, sir. Also request the editors who contributed to the editing of the book, Dr. Nandakumar, Dr. Pushpanjali, Dr. Medara, please join us in reading the book. And one or two youngsters, Pushpa, who also worked very hard on this. May I invite Dr. Sundaresh also to join us to unveil the book, please. Dr. Kanari, if you are here, that will be a part, represent all the institutions. Dr. Kanari, please. Please join us as well. Trying to ensure most institutions are represented on this platform. Yes. Thank you.
Thank you, sir. First, to share his experience compiling this compendium.
Also, nowadays, the presence of our international colleagues, Dr. Prabhakar Velu, Dr. Steve Wayne from University of Illinois, they have joined us online. I know it's very early out there, but they managed to wake up and join us. Thank you so much, Prab and Steve. We also have Dr. Pete Pope, the professor in Med Microbiology, University of Manitoba. I don't know if Natasha and others have joined. They are here. Thank you so much, Keith and Natasha, if you are able to hear us and join us. There is Keith waving at us. I know it's 5:30 at Winnipeg as well. They managed to get us. Thank you so much. I don't want to speak much. I think you could rather. I would like to maybe share a few words and invite a few others who have participated in this beautiful venture. First of all, I don't know if I should say, is it an happy occasion or not, because COVID has again come back. And just last 24 hours, we recorded the highest number of cases in a single day. It surpassed the previous peak that we recorded. Now it's close to 1,50,000 in just a matter of 24 hours. So it's not really a happy occasion. Yesterday, when in our meeting with Mr. Chairman, he asked a very profound question. It's been 1.5 years since the COVID happened. Are we aware of what's going on? Do we have a control grip? And we thought for a few minutes, myself, Dr. Nanjan, Professor Ram was there. It was a question very difficult to answer. Out of my own intuitive reflections, while I'm a scientist, but often we fall back on these helpless, intuitive moments. Where is the answer? Again, why are we still not able to? Of course, we have made a great progress, yet it's too few feet away from us. As true researchers, in a true spirit of research, I think the quest continues, the question of inquiry continues, and we wait till the knowledge dawns. But certainly in our discussions, it cropped up that a lot of predictions that were made a year ago, 1 month after the epidemic, or 2 months after the epidemic, every other prediction was dispelled. Somehow telling the scientific community, the research community, that we cannot really conclusively say we know. Somehow it's, of course, most research problems are a challenge, but COVID-19 seems to be a challenge of a different order. It's not let any scientist anywhere from any background pause and say, I know. We've heard from many extremely well-known, reputed scientists, epidemiologists, very confident they say something, but within a month or two, they themselves were forced to change their view. So some of COVID-19 has been such a challenge. In this context, what is it that we can? I think in some way, all that we can do is as a group, continue to work together, continue to collaborate, continue to pursue the path of knowledge and keep learning as we go on. Every patient that we serve, we learn something. Every lab experiment we do, we learn something. Every health worker and the lives that they touch on the field, we learn something. In some way, learning itself, I think, continues. In this backdrop, I'd like to introduce this book. The book is titled COVID-19, Many Facets and Dimensions. It's approached from a multidisciplinary perspective. Close to 90 authors from across the world, almost 50% of them from Ramaiah Group of Institutions, across the disciplines of public health, social sciences, epidemiology, microbiology, biotechnology, clinical sciences, dental, nursing, integrative medicine, Ayurveda, and then education and policy. Across the disciplines, we have experts who have contributed to this compendium with their thoughts, with their experience. Lastly, it's the review of current experience, what we know. And COVID-19, we can definitely cannot afford to say we know it all, but our approach, our thirst, I think, should continue. In that light, this book is definitely a testimony to what is the need of the current day in terms of we all coming together in our fight against COVID, and we continue to. This book is dedicated to all the COVID health variants. Many are still fighting strong. Many have lost their lives. Ramaiah also was on the front run. And there are many examples, and some of them will be referred to toward the end of this program, and we continue. In this context, I would also like to invite Dr. Prabhakar, Dr. Keith, Dr. Steve to share a few words, because this book would not have been possible had it not been a rich contribution from the teams out there, from University of Illinois, University of Manitoba, University of Nairobi as well. I would like them to share a few words. Dr. Prabhakar, over to you. Hope you can hear. We would like to hear you as well. Rob, you may have to unmute yourself. As Ram gets ready, Keith, would you like to share a few words? Keith runs a great program called International Infectious Disease and Global Training Program. Draws in PhDs and postdoctoral students from across 4 different countries: Canada, India, Colombia, and Kenya as well. Ramaiah also is a part of this initiative. We have a few PhD and postdoc students who already participated. Keith, if you can hear us, we would like to hear you as well.
Publication only. The quality in that way.
May I have to unmute?
Makes us as the university to think in the long terms and ensure that we have such facilities. Otherwise, there is no purpose.
Can you hear me, Dr. Krishnamurthy? Try now, Keith. You are unmuted now. Technology does play with me sometimes.
Murthy, can you hear me? This is Prabhakar. Can you hear me?
I'm not able to hear you, Keith. You may want to send a message out on the chat box
And I can read it.
to one. Okay.
Dr. Krishnamurthy, can you hear me? Can you hear me?
Steve.
Yeah, we can hear you, Chris.
Can you hear us?
For sensitive, right? Meanwhile, can I invite Dr. Nandakumar and Dr. There are few words as we set the platform right.
Dr. Krishnamurthy, can you hear me?
Honor to be here on this platform. And vividly remember last year around the time when he and I we were talking about the epidemiology of COVID and NS Murthy sir and myself we had tried to predict here model the rising number of cases. But Guraj are smiling that all the predictions have been sort of like inverted. Actually, our idea was to bring the experience because as Murthy was a budget onto your platform, and we were sure that it is not going to be a cross-sectional one.
I haven't tried to.
Had to and probably relearn from our whatever that training and the experience that we would have gained had to be spread and distributed across for a larger group to use. With that intent, the initial idea was to bring out a special edition in one of the that was used not only by our own college. And with the good offices of the student well-wishers and
I think it's all just a mumbo jumbo. The host has to unmute us so that we can speak. But others have to really mute their phone.
Categorize the learnings from the epidemiology point of view, medicine point of view, the surgical expertise, and also some of the social issues, nursing issues, and what we see today is the culmination of those experiences. So in that sense, it is it will not stop there. Probably think that we might have to go for volume 2, volume 3 as the learning progresses, and it will culminate in a far more richer evidence for our actions. What to do and how to do and answer a few questions. And once again, thanks Murthy and the team this opportunity to put together such a wonderful compendium. So it's a real an honor and everyone for this opportunity. Thank you. Steve, would you like to try now?
Okay, hello, can you hear me? I'm talking, can you hear me? No?
Meanwhile, I'd like to invite our younger colleague, Dr. Tushar Shah. He's a med micro, one of those persons who worked very hard. This book has come to light, and his team's effort behind. I would like him to share a few words.
Over to you.
Good afternoon to one and all. First of all, I'd like to thank Krishnamurthy to give me an opportunity to work with this book, COVID-19, Many Faces and Dimensions. I'm a very young faculty who joined the Ramaiah Group just last year, in March. And very soon the lockdown was initiated after I joined the institute. But this was the first task given to me by Dr. Krishnamurthy, and I must say that it has helped me to gain a lot of experience and knowledge, work with people around the globe, which I think is one of the greatest opportunities for a young researcher like me. So I have learned a lot, and I think there is yet more to learn. So thank you so much.
Very beautiful thing that happened is authors here collaborated with authors from University of Illinois, Manitoba. They're able to jointly pick up some papers. Hope you will have a good reading, enjoy reading. And I know several of the first authors are here because the COVID restrictions, we were able to invite just a few. And as you, at the end of the event, as you're walking out, please pick up your copy. We'll make sure that everyone gets a copy. And with that, let me try one last time. Keith, Steve, I'm hoping and praying that this time will go.
Hi, this
Keith,
is
would you like
Keith
to
Folk.
try one last time?
This is Keith. Can you hear me now?
Oh, looks like prayers are over.
Hi, this is Keith Folk. Can you hear me?
Yeah, can you please first speak?
Talking, I think this speaker is not working. He was already talking.
We can hear.
Yeah, YouTube is on. We can. Yeah.
Hello. Testing. Can you hear?
That's it.
Test.
We can hear you, Dr. Keith. It seems the people in the hall can't hear right now.
Okay. Thank you.
Hear the speaker.
Dr. Keith, can you please try to speak loudly?
Hello, this is Keith Folk from the University of Manitoba.
Yes, we can hear you loud and clear.
Okay, great. Thanks very much. It's a great pleasure to be here with you today. And I wanted to thank very much Dr. Krishnamurthy and also Ramaiah University for the opportunity to participate in this great endeavor. We all know that COVID is an international issue, and it's spreading throughout the world at a great pace, and it's very concerning. And I think this book is a great example of how the best way to battle COVID is to spread knowledge internationally and throughout the world. So I think that I'd like to thank all of the participants. I'd like to thank the trainees across the world who put this together. And it's only through having knowledge transmit faster than the virus will we be able to come to an end of the COVID crisis. Thanks very much. Have a good day.
Hello, can you hear me?
Yes.
Are you able to hear me or not?
Yes, we can hear.
Yes, okay. This is Steve Wine from Chicago, University of Illinois, Chicago. On behalf of UIC and the Center for Global Health, I want to thank you all for the opportunity to collaborate on this really meaningful project. This is a book of great intelligence and humanity in all kinds of fields, from basic science to clinical science to social science to policy, representing all disciplines within healthcare. It's really an amazing testimony to the commitment and to the professionalism and to the humanity of a very wide network of collaborators. I want to echo what all the other speakers have said. I want to thank all of the authors for their contributions. I want to thank you for including UIC, and let this be just kind of one marker on a path of continued collaboration and dialogue to address COVID and all of the other healthcare burdens that that we face and that we share. So thank you again.
Dr. Prabhakar, can you hear us? You please try unmuting yourself.
Thank you so much, Keith, and Steve, and all the others who shared here. Steve, more importantly, for taking the time out to contribute to this big campaign. It was not easy times working in the clinics that I can go back and take some time out to write down something.
Yes, sir. I'll put Rob on the phone. So if he wants to speak, sir.
So thanks to hear. Yeah. Good evening, everyone. Not just that I want to speak. I was asked to speak. So this is to me, having been coming to Ramaiah for over the last 6-7 years. This is a very important, interesting part, at least, of my experience around. This is an extraordinary effort of people both within and outside of Ramaiah. And to launch both the book as well as the software that's going to help, COVID-19 escape that. I think it's a remarkable achievement, and it's a true spirit of collaboration, cooperation. None of this would have happened without the extraordinary efforts of Dr. Kumoti and Dr. Manjit Chowdhury. And equally important is the extraordinary support from the Ramaiah management. And I wish everyone the very best, and let's look forward to looking at COVID-19 and in our rear view as they say. So I wish all of you the very best, and enjoy the rest of the function. Thank you. Thank you so much, Doc. Great to hear. In fact, the only role people like me who played here is that of facilitator. Definitely we can't lead from the front, because this is the time of collaboration, time of multidisciplinary. NEP, National Education Policy, emphasizes, and some of us are new to Ramaiah, and everyone who was so open, so generous, accepting, and everyone led from the front, within their clinics, on the field, in the laboratories, as you wrote the paper, as a publisher. I think that's why I see some of us see our roles as a facilitator. That context, I think I would like to thank everyone for so generously participating. And as Dr. Nandakumar said, we'll keep the tempo on. This is just initial effort. Going forward, I think there's more that we can do when we come together. And I think we'll continue to respond to the need of the hour. Once again, thank you so much. And over to you, Chief.
Now, we invite Dr. Ramaiah Chowdhury to take us through the demonstration of Sharple application with the stage. Dr. Andrew,
It's a message from Steve on behalf of all his team members. Our team at UIC thanks you for the opportunity to collaborate on this book of great humanity, intelligence, and commitment. This book, to which so many contributed from many disciplines, many countries, and many walks of life, represents the best of our professions and our humanity in confronting the challenges of COVID and the real burden. Thanks to all for their amazing contributions. It will be a source of pride and learning for years to come. Thank you so much, Steve, and the UIC team for this lovely words.
Thank you, Dr. Chairman, Honorable Chairman, Honorable Chief Guest, Dr. Gudas, Honorable distinguished guests and esteemed colleagues, both here as well as in USA, Canada, and also in Brazil. We forgot to mention Dr. Mark Perron, Vice President of Industrial Federation. He's with us from Sao Paulo. So it's a really momentous occasion for all of us. Thank you for giving us this opportunity, and very hearty congratulations to Dr. Krishnamurthy and the entire team of, I guess, about 90 authors who have accomplished this fantastic task. Despite the uncertainties that we had to be presently. So, seems okay. Next. Hello? Yeah. It's better. So, I think it's an important lesson for the entire mankind. In a sense, we can look at it from an oxymoron state. One, the devastation that it has caused, the number of deaths that have taken a toll, and the number of cases that are still emerging in the repeat wave, and also there is indication that more pandemics are actually in incubation. At the same time, if we relook at it, the resilience that the world has demonstrated together is also very remarkable. It has happened only after 100 years of the Spanish flu. So the resilience with which our own country has stood up is highly commendable. And not only health has been affected, every sector has been affected. At the same time, we as a nation have also stood up with this pandemic. We launched a revised national education policy during this year, which sort of unleashes a lot of new hopes about how to go about pedagogy, given the fact that the uncertainties are here to grow and not restrain. And I also, when I was going through the NEP, I also came to know it emphasizes on Bloom's taxonomy. I know that there are a lot of pedagogical experts here. They are very well versed in Bloom's taxonomy. What we noticed several years ago is that Mr. Benjamin Bloom talked about knowledge as an endpoint in 1956 when he sort of first came out with this taxonomy, which was revised by cognitive psychologists in 2001 to new knowledge creation as an endpoint of learning, which we have been debating. In my understanding, conventional pedagogical system cognitive learning is paramount, particularly in an education system that we are accustomed to. Bloom also talked about affective
learning and psychomotor learning. I'm not sure how much in India we follow affective learning and psychomotor learning. But cognitive, yes. I mean, our students have done extraordinarily well, both in India as well as in the entire world. However, the standard of learning, standard of basic skills in India still is questionable in majority of the students, as studies have said. What we have done is, we are trying to understand what are the major gaps in learning. And today, when unemployment rates have gone like worse than ever, we need to give students vocational capabilities, skills, and competencies. And with that in mind, several years ago, me and some of my Maverick colleagues started working on experimenting with different pedagogical systems. And there was born this concept of flipped classroom that we can actually experiment with. We have extraordinary stalwarts here about pedagogy and who know about flipped classroom. So we talked about blended learning, which can contribute rather as a complement to the existing pedagogical system. So it's not a substitute of what exists today, but as a complement of a hybrid system that we want to present. We are talking about information given to the student at home or at their convenience, and then use that information in solving problems in the classroom, which is not involved, not just in India, but anywhere in the world, unless there are more sort of progressive educational systems. So with that experiment, we have come up with this platform called Sharpen. I don't want to belabor the point as to why we named it Sharpen, because it's a long history. Like Mr. Will talk about that. We've been working with adolescents in schools for a long time. That's why it's about students' health action through recreational physical education and nutrition. That's the history part. I want you to have a look at what we have developed. And then I would invite you to collaborate with us, suggest us how we can make it a very happening system. This is intended as a complement, as I repeat, to the existing pedagogical system. It's not a substitute. It's also intended for refresher training, short courses, certifications, competitive examinations, but importantly, entertainment of the students and continuous learning. I would invite my colleague Shelly from Pune to take you through the system. And if at all the technical glitches happen, I will sort of try to do the demonstration. Shelly, are you there online?
Yes, sir. Good evening.
Yes.
Good evening, everybody. My name is Shaili Shah. I serve as a senior executive at RIC5. I would like to thank all the dignitaries, esteemed Chairman Sir, Dr. Gururaj Sir, and the rest of the team for giving me this opportunity to demonstrate our platform that Dr. Nayanjit has aptly just given a brief of how it was named Sharpen. So before I share the screen and take you all through the flow of the application, I would like to talk a little bit about what it is that the application intends to do. When we came up with the thought of Sharpen, we conducted an in-depth study and we went through a lot of digital training platforms and tried to imbibe everything that was good about those platforms and compile it together to create one hybrid platform, which is simple in nature, but at the same time, it covers major features that you would find in any other state-of-the-art technology that is present in the edutech world today. So based on all the consumer surveys and the feedback that we conducted, we tried to incorporate these features and we came up with a very, very customizable platform, which is so flexible that everything can be changed. You want to add photos, you want to remove photos, all of that can be done as well. And I would also like to emphasize on the fact that there is an inbuilt survey tool within the application, which is not live as of now. However, for conducting studies on the field, it could prove to be a very important tool where researchers can use the survey feature, which is already embedded within the application, and conduct their studies. So without further ado, I would like to share my screen and take you all through the application. I hope my screen is visible. So this is what we call as the front end of the application. When what you see here is that I have logged in as a user of Department of Health and Family Welfare, Government of Karnataka. Now my institution has mandated me to complete these courses, which I see under featured courses, one of them being the COVID-19 Kannada course and the same course in English. So based on my language preference, I can choose to go through either of the courses. Another feature that you see on the home page of the application is a very, very relevant news and articles feed, which can be generated or updated on a daily basis. So the end user who wants to study or go through evidence-based article in a particular domain, which could be anything from public health to nutrition to COVID-19, could access these evidence-based articles and update their knowledge. Now I'd like to take you to the COVID-19 course. So when one clicks on the course, what they see is the overview of the course, which talks about the learning objectives, who the course is intended for, how many chapters does the course have, how many multiple choice questions do they need to complete in order to complete the course, and so on and so forth. The chapter list here also gives us the list of all the chapters that one needs to complete in order to go through the entire course. Now, of most importance are the question types. As Dr. Nayanjit mentioned, we are trying to imbibe the flipped classroom system within the application, where the emphasis is on asking the question first and then learning the content, as opposed to what has been practiced through ages, where the emphasis has been on content first and then going to the questions. However, here, via multiple choice questions, we intend to promote problem solving skills among the end users and ensure that they understand the concept at hand in a much more clearer manner. The question types have been divided into two different sets. We have the take a test module, which is essentially a timer based test module, which you as the end user can sort of try to attempt after the end of each chapter or at the end of the course, and you can find out how strong or how weak you are in your performance or understanding of the course. The brain train is designed more as a practice module where you solve multiple choice questions and you clear levels and you can practice the questions and understand the concept. So allow me to take you through a couple of levels in the question here. Let us try and attempt chapter 5 response during a pandemic. How long should you wash your hands with soap and water? Well, I think it should be at least for 30 to 40 seconds. I will check if my answer is correct or incorrect. Looks like I got the answer wrong. So the algorithm will tell me whether my answer is correct or incorrect, along with giving me a very short explanation and an external link of an evidence-based article. It could be a WHO or an MOHFW article which talks in more detail about the topic or the question at hand. So this is how, if I'm interested to learn more about the topic, I can go through the evidence-based article and find out more. Also noteworthy is the videos feature that we have embedded within the in the application. So here we have our beloved Dr. Bellur Prabhakar sir, who's talking about introduction to the COVID-19 app, COVID-19 course, and he's talking about the genesis of the virus and how it originated. So the end user can also attempt to learn more through these videos, which are compiled by experts. There is also an inbuilt messaging feature within the application. So I can directly message my peers, or I can also message my course expert and resolve any queries or any doubts on the go without having to rely on external sources like WhatsApp or email or telephone. So the inbuilt messaging feature allows me to communicate seamlessly within the course itself. Now, as I mentioned earlier, this is a very simplistic, no frills attached front-end application. However, the USP of the application is its very, very dynamic backend. Backend is what we call as where you enter the details about a particular course. So me as the course creator has the liberty to enter any sort of details, create any number of courses or any number of multiple choice questions, add videos via this backend that I have here. I'll show you how simple it is. So I can go to my course, and on the grid here, I see the feature where I can just click on the add course button. And all I need to do then is fill in this template, and it will allow me to add a course once I click on the add button. So all I need to do is enter all the relevant information with regard to the course, and my course will automatically be updated in the backend or in the database, and I can then start adding questions accordingly. Now I can also show you how to add multiple choice questions, which is also in a similar manner. All I need to do is click on the add button, fill out what chapter does the question go to, whether it is a practice question or a test question or both. The level of difficulty, 1 being the simplest, 5 being the toughest. And I have dialog boxes where I enter the question along with the options. And here is the dialog box for also entering the explanation. And once I click on the add button, my question will also automatically go under that particular chapter for that particular course in my database or in my backend. Now, if I, as the course creator, want to ensure that whatever I have, whatever content I have come up with is authentic in nature, I can request an external expert to review my entire course. So the panel is very easy to use for a reviewer also. All they need to do is, once they are made the reviewer, they need to enter the backend and submit their reviews here in the dialog boxes that have been allotted for them. They cannot make any change to the content or the question, but they can give their feedback here, or they can also give an overall feedback over here. And once they save their review as final, I, as the course creator, will be able to check if the suggestions are valid and if I need to incorporate them in my final course. So this is how we have tried to keep the backend as well as the front end very simple in its approach. Anybody with even limited knowledge of technology or smartphones can have access and come up with multiple courses using the backend of the platform. I would like to stop here and request Dr. Nainji to take over. Thank you very much for listening to me.
So on 5th of February this year, the previous Health Commissioner, Mr. Pandey, and our Honorable Chief Executive, Sri Murthy sir, they inaugurated this COVID-19 course for the frontline health workers of Karnataka. We are in talks with State Institute of Health and Family Welfare now to disseminate the system across the districts. So we propose to give dashboards of performances of the frontline health workers at every district level, and then update them as to how they can incorporate more changes in their training. There is one more course which is ready now, which is mental health training for adolescents. And we have Dr. Virupaksha here who has reviewed the course. If you can quickly talk about your experience, we'll be really grateful.
Thanks. Good evening, everyone. At the outset, I would like to thank Dr. Nainji for giving an opportunity. I feel honored and privileged. I work as a psychiatrist. One of the important challenges since the pandemic has been explosive growth in the psychiatric disorders. And in fact, WHO is predicting that the next pandemic, once the COVID ends, is a mental health pandemic. So considering that, it was quite important that we run the course, and it was quite refreshing to see that there was a mental health training course for adolescents and how it was conceptualized. And like Shelly was also saying, there was a question, and then the adolescents can go back and learn about those concepts. As a reviewer, there were around 6 chapters which would look at the most important aspect of an adolescent life in terms of probably exposure to the screen, exposure to the social interactions, how restriction in their behavior would impact the mental health issues. I've been working with UNICEF now as an external consultant. We have had 4 sessions for UNICEF staff as well as kids, where the amount of stress on adolescent and pediatric population has been significantly higher, and that is going to eventually blow into a major crisis in the future. So I think that was a welcome step in designing these type of courses, and we were also discussing that we can expand and probably include other forms of training as well as education material. And thanks for giving me that opportunity.
We are writing several other courses in collaboration with various faculty. Here, one of them is management of diabetes and hypertension at the primary care level. And Dr. Pramila Kalra has been helping us with the review. We'd like to come to the front so that others can see you and tell us your experience. What about that?
Good afternoon, everyone. Yeah, it's been really nice to work with Dr. Nayanjeet, and I'm working as professor of endocrinology in this institute. And I've been working closely with Dr. Nayanjeet on this app as well and many other programs as well. And it's a very interesting thing because when we talk about diabetes or hypertension or pre-diabetes management, it's not the endocrinologist or the diabetologist only who are going to play a major role. It's actually the worker at the primary health level or the primary healthcare worker who is going to play a major role. And actually, these courses may be very beneficial for such people because we know that these courses actually help them to understand, because like we are doing a lot of teleconsults with our 5-1 patients and village patients. And what we find that if the local healthcare worker or the local person who is in contact with that patient knows at least how to interpret their glucose values, knows at least the basics of hypoglycemia, how to manage it, how to manage an emergency associated with diabetes, it makes a huge difference. And these courses can be very useful for such people. And not only at that level, we can have various levels of these courses, because I have reviewed these courses and what I found that we can always expand the horizon and we can use it at various levels. So it's not only at the primary healthcare level, it's not only at the level of the district healthcare level, or it can be at any level. Even our educators who work with us, if they do these courses, they can get a much better idea. Through that only, we organize a quiz also on Diabetes Day, and we use these modules somehow for framing the questions. And we found a very good response, and we found that it actually helped, and everybody was happy to participate. So I think this is how we can disseminate the knowledge and create more people to help us, because like Dr. Virupaksha said, mental health, we also know that diabetes is another problem, and obesity is something which is coming up in a very big way, and more so because of this epidemic. People are inside, not doing exercise, and we are seeing even a higher number of children coming with obesity, diabetes, young adults coming with that. So I think that way these courses are going to be very useful, and we can always go on making them better, and at various levels we can use them. So I thank Dr. Nayanjeet for that. Thank you.
Thank you very much, Dr. Pramila. So I'm sensitive of the time. We have been working with the Department of Gynecology at University of Illinois, Chicago for a very interesting program on menstrual hygiene education for Indian adolescent girls and female athlete triad among American adolescent girls. So, and it has been championed by a teen herself from Georgia called Zia Verma. I'm very pleased to take her name. She's a 16-year-old athlete who wants to do a Girl Scout experiment, and she approached us for this. She said, I was a victim of female athlete triad. For those who do not know what it is, no, young girls who take a lot of physical activity and sports land up becoming amenorrheic. So they do not have the regular periods. They go through a lot of physical and mental trauma, and this is a phenomenon happening in the developed world. Probably also in India, we do not know because we don't have data. So because she has recovered, she wants to now help other teams. So we are working on this. It's almost ready. We are working with the University of Illinois Chicago to see how we can launch it. Of course, we have to customize it to the American kids' needs as well. Professor Steve has expressed his willingness to use our system for management of mental health in patients. I don't know whether Steve would like to say a word. Otherwise, it's okay. Steve, are you there? No. All right. So, but if there are questions or comments, we'd be very happy to hear from the audience. Otherwise, I'm ready to hand the mic back to Dr. Chetan. Thank you very much for your patience.
Thank you, Dr. Nayanjeet, Ms. Shahi. Definitely, thank you for sharing your inputs. Now we have a short film on management, COVID management at Ramaiah, titled as Masking the Virus. So, we stop the lights.
COVID-19 has raged on relentlessly and taken thousands of lives, leaving the medical world in a quandary. India too has been no exception. Thousands become victims every day, especially in the big cities. It was a big challenge for us at Ramaiah Medical College and Hospital to understand this virus and build a protocol to treat the patients who flooded the hospital. We rose to the occasion and were the first teaching hospital to volunteer to treat this highly infectious disease.
As early as mid-March, we took initiative to start off a ward or an area dedicated for COVID because we know that it's an infectious disease. We wanted it to be separated. So with that process, by the end of March and early April, we were able to start a dedicated COVID facility. So we oxygenated all the beds. So we made 2 or 3 beds, ventilator-enabled beds. We were also the first probably to enable a dialysis bed also in that.
Working on the treatment method, learning the right way to don and doff the PPEs, nutrition for the patients, online consultation, and information hub for the people, where doctors give individual attention to the patients was all part of the training and confidence building measures. Teamwork is now the keyword, which has helped us overcome many hurdles to handle this unprecedented crisis. The process put in place has now become a benchmark in handling this disease. Doctors from all departments have put in their expertise to strengthen the treatment now. A vital arm of this protocol is the biomedical waste management, which is systematically dealt with every day. A plasma bank in the premises is a novel, successful way to treat the infection. Patients have been grateful for the extreme care and compassion by healthcare workers.
Ramaiah Hospital were always there. The patients feel at home. There's absolutely nothing to fear about. We come through and everything will be fine.
We are also geared up for the possible after effects of the virus.
What does COVID care in our institution mean? Any patient that has gone home after the initial acute care will be taken care of for the next 2 weeks with the virtual COVID care situation. Physicians are available for them, nursing will be available for them with the day-to-day monitoring so that they can do a good care of it.
A strong management support and willingness to think out of the box, a commitment towards suffering people has helped us in our venture to fight this virus.
And when this pandemic started in this country, our management decided to volunteer to create a
So, as Jana said, technology has known ups and downs. So, apologies for the last speech there. So, but expect all of you to put your hands together for the frontline workers and by our own in-house team at the Ramaiah Institution. So, that's it was the view. With that note of positive outlook towards this COVID-19 management, I take some opportunity to introduce the chief guests. I know that the scholars in the domain of epidemiology know our chief guest very well. There's not much introduction required. However, there are scholars from multidisciplinary domains. So I take this opportunity to introduce our chief guest, Dr. G. Gururaj. Dr. G. Gururaj, currently Director, National Institute of Mental Health and Neurosciences, Bangalore. Dr. Gururaj plays a lead role as Senior Professor in the Department of Epidemiology, Center for Public Health, and the WHO Collaborating Center for Injury Prevention and Safety Promotion. After completing graduation in medicine and post-graduation in community health, Dr. Gururaj underwent training in injury epidemiology, prevention and control at CDC USA in 1990. WHO Collaborative Center on Injury Prevention at New Delhi, completed postdoctoral fellowship at the WHO Collaborative Center on Neurotrauma Prevention at UCLA School of Public Health at Los Angeles, USA in 1997, and at Delft University in the Netherlands in 2012-2013. Dr. Gururaj's major areas of expertise include epidemiological and public health research, developing surveillance and information systems, promoting institutional mechanisms, capacity strengthening and training, advocacy, facilitating legislation, monitoring and evaluation, as well as strengthening policies and programs. His major areas of interest are in the field of mental health, injury prevention, and safety promotion, including road safety and suicide prevention, child safety, workplace safety, and NCD prevention and control in workplaces. He has completed many funded and non-funded research projects and published many papers in international and national journals, monographs, manuals, reports, policy briefs, and advocacy materials. Dr. Gururaj has presented scientific papers in many scientific meetings, workshops, seminars, and has been a resource person for many national and international organizations. Sir, we are indeed pleasure to have you here with us today on such a auspicious occasion of World Health Day. We are all awaiting your words of wisdom to us. Look forward to your thanks.
Thank you very much, and good evening and namaskar. Greetings to all on the occasion of the World Health Day, which has the theme of building fairer and healthy society. World Health Day, as we all know, is celebrated every year around April 7th to identify a topic that is relevant globally, nationally, and locally, to initiate with large number of advocacy efforts that would lead to meaningful programs and actions. The theme chosen each year is decided very carefully, and it takes about 2 years to come up with a theme for the World Health Day that will be held 2 years later. And it's a very lengthy exercise. I participated in this a few years earlier. and a lot of advocacy goes on. This year's World Health Day is especially something which is a very, very disturbing one, but at the same time, somewhat positive in some areas. At the outset, I would like to pay tribute to all the frontline workers and all the people, not just the health professionals or health people, but many, many, many other workers in different departments, in different sectors, different areas, and in different places, who stood right in front and took charge of the situation and managed it with whatever resources they had at their disposal. We know that many people didn't have any resources, managed it locally, and many people came forward in different ways to help them, to be with them, and to be a part of this process. It was exactly 1 year back that we started feeling the real effect of the COVID-19 pandemic. India started its first screening for international passengers on March 16 by putting stamp on people's hand, by asking them to fill out a form, by taking their phone numbers and calling them up. That was the first day effort which started on March 16th of last year. On April 6, 2021, if you remember where we are nowhere near to the initial dialogues and debates that were held on television or in newspapers or in selected professional meetings. Everybody said, we will win this war in 3 months. We will conquer this disease. We will defeat this virus. We will put an end to this because we are at a time where knowledge is in our hands. Technology is in our hands. Resources are in our hands. Money is at our disposal. We have the young Indians who are ready to come forward and take charge of the situation. A lot of these things were heard. But exactly 1 year later, as Dr. Krishnamurthy said, we have seen the highest surge in the number of cases, even as compared to last year. We have learned a lot of lessons. Undoubtedly, we have responded to this situation. Healthcare institutions like Ramaiah institutions, many, many others at different places, took the lead, came forward, established mechanisms for dealing with this, strengthened their manpower, allocated resources, did develop training programs, did human resource strengthening, did not just one activity, but several activities were put in place by the administrators, by policymakers, many others. And I think some part of this war was addressed. But if you have seen newspapers today and two messages that are floating on WhatsApp University, you'll be surprised. One message comes from an Italian researcher who is quoting findings from a study of Johns Hopkins, who says that there is no coronavirus. This is today's news. I'm not quoting 1 month news or 1 year news. He just says it is because of electromagnetic radiation and its effect, and there is no virus as such. There is another bit of news from a senior politician of this country, the Chief Minister of Uttarakhand, who says we will allow Kumbh Mela to go on this year, and it is the faith in the people which will kill the fear as well as the virus. The two examples that I'm giving also shows the diversity in our thinking, in our understanding. Ultimately, what will our Chikana, Dodana, Mutana in a village do? Will we listen to the 9 o'clock debate where between 9 to 9:30 it says that vaccination is good, and between 9:30 to 10 it says vaccination has major side effects? So what will Chikana, Mutana, Dodana do? Ultimately, he makes his own decision. He thinks and he does, he acts whatever he believes in. The reason I'm putting this is that with globalization, industrialization, and migration and increasing living standards, many changes that accompanied this process few years back, few decades back, brought a very different sense in the minds of people. And in the whole world, everyone thought that we are on the right path and we are progressing so well, nothing can stop us. But COVID took us back a century backwards and taught us that we have not understood many things in this world. And one such thing that we have not understood is the public health dimensions of diseases that affect people. We might have made significant progress. Even today, we have confusion at what blood level a diabetic should be properly treated with what medicine. Despite years of research, despite huge success and progress in the management, we have seen change, but the debate still continues. There is a lot more that needs to be understood and a lot more that needs to be done. It's very, very important. The pandemic has taught us for the first time in recent years one or two major lessons. One is an investment in larger public health is very much essential. We have seen the weak public health systems just break down under COVID and running helter-skelter and not able to respond to the situation in the proper way. I talked to a district health officer during the COVID-19 pandemic in North Karnataka district. And I asked him, how are you managing the situation and what the guidelines are you following? All that. He told me in very simple sentence. Doctor, ನಮಗೆ ದಿನಕ್ಕೆ 6-8 ಗೈಡ್ಲೈನ್ಸ್ ಬರುತ್ತೆ. ಸ್ಟೇಟ್ ಗವರ್ಮೆಂಟ್ ಇಂದ ಬರುತ್ತೆ, ಸೆಂಟ್ರಲ್ ಗವರ್ಮೆಂಟ್ ಇಂದ ಬರುತ್ತೆ, DC ಇಂದ ಬರುತ್ತೆ, ಕೋರ್ಟ್ ಇಂದ ಬರುತ್ತೆ. ಎಲ್ಲ ಕಡೆಯಿಂದ ಗೈಡ್ಲೈನ್ಸ್ ನೀವು ಇದು ಮಾಡಿ ಅಂತ ಹೇಳ್ತಾನೆ ಇದ್ದಾರೆ. ಬಟ್ ನನಗೆ ಕಡೆಯಲ್ಲಿ ಏನ್ ಮಾಡ್ಬೇಕು ಅನ್ನೋದ್ರ ಬಗ್ಗೆ ಸ್ವಲ್ಪ ಡೌಟು. Exact words which you use. I'm not, telling this, but this is the reaction of a district health officer at the height of a pandemic, when messages, adversaries, guidelines were floating like anything to all places. I'm not telling these are wrong things. These are all much required things. These are what are essential requirements for a public health system to be built. At the same time, we have seen the huge debates that are taking place every day with regard to a very simple thing like reopening of schools, conducting examinations. We still don't have answers. Recently, I was in a program with regard to the elderly health. And one thing we have done, the huge impact of the pandemic is on the elderly people. Many people with non-communicable diseases like diabetes, cardiovascular, cancer, stroke, Parkinson's, other severe mental health conditions couldn't get access to care. At the same time, couldn't go out and didn't have much support systems. The point I'm trying to bring into your notice is that it's not just managing the pandemic alone, but managing any public health problem that affects large segments of the society for which we have some little or greater understanding, for which we have some interventions that are available, and that which can help people at large, needs an investment in building systems. And it is building these systems which is very, very crucial. So health systems is something that is very critical and that requires a huge investment. And towards building the systems, efforts by the Ramaiah Group of Institutions, as we have seen today, the compendium on COVID-19, which brings the much required knowledge into the public domain, into professionals' mind, and into the policymakers' arsenal, which makes no difference. And in some cases, it can set the ball rolling and can make huge difference. I think this is a very, very important thing. Similarly, at a time, we have seen in the last 1 year, the greater emergence of technology in healthcare field to a very, very significant level. In fact, even at NIMHANS, we have seen the growth of several online courses, online consultations, telemedicine, telediagnostics, telehealth services, telenursing, everything becoming tele and with the use of information technology in a much, much bigger way. So another attempt that we saw today, Sharpen, is another great contribution, and especially looking at the adolescent education. And I think it is the adolescent phase of life, which is a very critical part of one's life, because as we say in NCDs, that's where most of the NCDs start. And if they can be addressed at an early stage and at an early period in life, it makes a huge difference to the larger society at large. And I would like to congratulate both Dr. Krishnamurthy and Dr. Nayanjit for this phenomenal effort and developing these initiatives and taking it forward. I'm sure it will catch up in the coming days and definitely will make a bigger impact. The greater importance is that if we really have to succeed in managing our current health problems, many times we try to do one and hope that that alone will be the cure. But that doesn't happen. Globally, in the last 100 years, we have learned lessons from many, many countries and many populations and in diverse field of health. What we need is putting things together. I just submitted an article 2 days back to National Medical Journal. It's called Speaking to Myself. And it was on unhelmeted bike riders in India. The reason I wrote this is that for the last 4 decades, we know helmets work. We had a legislation in India since 1988. We have a new legislation from 2019. We have better quality helmets that are available in the market. We have helmets that come with ventilators and perforators, which make it less discomfort. We have lightweight helmets. We have chin straps that are of a good quality that are available today. We have a large section of young and mid-age population who know that helmets are important. We did a survey in Bangalore a few years back on about 12,000 IT employees and asked all of them several questions. And one of the questions we asked is, how do you think helmets help? All of them said that it definitely works. But when we ask them, do you wear it? I wear it only when there is a policeman on the road. And for this, we have 4-5 decades of knowledge, research, experience, policy, legislation, technology, information, everything at our disposal. But what is it that one thing that is making all the difference, and even today we still see on the roads of Bangalore, only about 60 to 65% of the people wearing helmets. And even among those who wear helmets, people wear, the cricket helmets, construction helmets, horse riding helmets, bucket helmets. We have different brands even within that. We don't offer much protection. It's just that one simple thing called the human behavior. As I was just opening the first few pages of the book, I was so happy to see the social issues of COVID-19 being covered in this book. And I would like to compliment the authors for keeping that in mind, because ultimately the society, the people and their behavior determines where we go or where we want to go. And it's important that we understand this human behavior, which is very, very difficult. And this is one thing. There has been very little or very less investment during the COVID pandemic on the behavioral aspects of people with regard to COVID. There's only one statement that we commonly hear: people are not wearing masks. Over. People are not, staying at a distance. Over. But there is something called human behavior, and that behavior is influenced not just by medical research, but by sociology, but by politics, by religion, by individual, values, availability. Many, many hundreds of factors make this huge difference and bring out that human behavior. So in providing information and knowledge to a common man is very important. We also need to do research on what are the positive and what are the negative things that ultimately change the trajectory of health in any given society. Even today, from the field of mental health, we know that despite several years of great advancements, we still see societies resorting to traditional methods. Not that it is, I'm not saying it's bad, but at the same time, how do we integrate the traditional and the modern thinking into taking the society forward? So the COVID pandemic has really taught us many, many things that we need to address in human society when we try to look at health of the people. And it's very, very complex issue, but at the same time, when professionals come together, try to sit and work and discuss, debate and take things forward, things start making a change. And an example is seen today with about 90 authors coming together to write the COVID-19 compendium from diverse fields, diverse topics, and on different aspects. As we stand in April 2021, we are not sure where we will be in April 2022. Like Dr. Nandakumar said, in last March, April, May, there were so many predictions done by very, very highly reputed scientists through modeling techniques on where we will be with COVID. But most of them have turned out to be far from true. And that tells us that unless our assumptions are correct, or our reasoning is perfect, our projections are very difficult. In fact, in one of the nuanced bulletin that we brought out in last April, we sounded out for the first time itself what India requires is a district level management and action plan. And I outlined several steps that we need to take to make the districts more responsive, because we are not sure which district gets affected when. Initially, it was a problem of the cities, but from cities it moved to districts, from districts it moved to villages. And the second wave is also happening in different ways. We may discuss and debate for hours and hours. Ultimately, we have only two paths. One, vaccinate everyone at the earliest possible time. Number two, bring COVID appropriate behavior. And number three, protect the elderly. This is again a point we have been telling for the last 1 year. If we can take care of our elderly people above 60 years, we can prevent a large number of deaths. We can prevent substantial number of hospitalizations. We can reduce the economic burden. We don't have to disrupt the society to a very great extent because our goal in a pandemic is to reduce death. Our goal in an epidemic is to reduce the impact. If we can do these 3-4 things and find ways to do it, which all leads us to the last point, unless things are implemented at the ground level, it is very difficult to see the change. We would like every primary health center, a community hospital, and a district hospital to be well prepared to manage the pandemic in terms of a preparedness plan and an action plan with sufficient resources and knowledge that can manage these situations. And that is where, with implementation, we will be able to move to a more fairer as well as a healthier society in the days to come. We have knowledge today. We have science that tells us, and we are capable of today of questioning the science. We are capable today of asking the right type of questions. We are also capable of getting the right answers. But what would be more essential is to translate these science to action. And that should happen at the ground level, through which we will be able to improve the health of our society, protect large number of people, preserve good health of the people, as well as promote health in the right direction. I'm grateful to the organizers for giving me this opportunity to be here with you this evening. And once again, congratulate both the authors of the book as well as the developers of the app, and wish you the best. And you already started off in different other directions, which will be very, very useful, and will be, we should see greater applications of this in the coming days. Thank you once again. Thank you very much.
Thank you, sir, for highlighting critical problems as well as solutions thereof. At the same time, highlighting the importance of shifting from silos to systems in order to engage with the pandemic in a confident way. Thank you, sir. Thank you so much. Now I request Honorable Chairman, sir, to extend a token of appreciation and gratitude to our chief guest today. Especially to come. Yes, please. Sir, please request you from our guys. Thank you, sir. So may I request the Honorable Chairman to address the gathering.
Standing myself to the divine doctors, Chief Gurvaj, Director of Marks, Chief Guest of this function, Mr. Srivas Murthy, the CEO of Medical, Mr. Dr. Saab, the Chief Executive of the Gokula Education Foundation, Velu Prabhakar, Stephen Green, Medara, Karanui, Chandresh, Dr. Sai Babaji, Dr. Krishna Jayana, and my dear participants. It is indeed a pleasure to be a part of this entry the book COVID-19, many facets and dimensions. Today on this occasion, the World Health Day, the book is a collective work of eight editors from 3 countries and 27 primary authors, presenting institutions, GDF and outside. Most importantly, the book is dedicated to all the COVID-19 healthcare workers for their extraordinary service during the pandemic. I'm happy to note the collective work of the team involved and note the timely and relevant work on understanding the pandemic and its many facets. The GFF has been in the forefront of many innovations, healthcare, the strong orientation towards the inclusive excellence. The book is a testimonial of the same. The time when the Ramaiah Group of Institutions are undergoing series of reforms in order to promote the best of research, teaching and services in its stakeholders, the hard work, critical and thinking and teamwork in finalizing the book, the beginning of such change we would like to witness in the near future. I congratulate the Nigel Chaudhary and his team for initiating the online application for learners who are keen to explore the innovations in health and healthcare. Pandemic has exposed us to the online mode of learning and teaching. Public health demands timely, innovative intervention. I believe the center will provide the required directions, make the best of the opportunities, amidst new challenges and opportunities. Sharpened application is one such example in this direction. Congratulations, best wishes to the team associated in developing this application. Thank you.
Thank you, sir. Just before we go to the vote of thanks, there's exciting news that Dr. Savita wants to share to the gathering again on the day of the World Health Day. So, please welcome to the class.
Thank you, Chetan. Chairman Sir, Caesar, and all the dignitaries of the dais. We had requested just 2 minutes of your time because we had something to share with all of you. One of our staff, Ramesh Devur, who's an associate professor at the Department of Physiotherapy, has always been an out-of-box thinker, somebody who tinkers with technology and a researcher. In 2018, he started, or rather conceptualized an innovation, which is called the FES, which really expanded stands for the Functional Electrical Stimulator, which is a huge step forward in the area of neurorehabilitation. He had developed a prototype, the proof of concept, and had successfully treated and worked with it in 2018. This is really it's a very small portable unit. We work with a lot of our stroke patients at Kaiwara. And what it does is for those who aren't able to walk, who aren't able to ambulate, it allows for muscle activity to be triggered in the normal physiological way so that people can start walking. And it gives me great pleasure to say to you that in early 2019, we approached the Technology Development Fund of the Gokula Education Foundation, which supported us, Dr. Ramesh, the primary principal investigator, to realize it into a product. the primary validation of this device is done. A patent was applied both in India and in the United States. Ramesh is now working to get for efficacy and multicentric effectiveness to go into commercials. The reason we are here today is it's a point of happiness because yesterday we received the legal papers from the United States for the patent. And a beautiful plaque for the same in the name of the investigators, but it belongs to GFM. We have Ramaiah here with you, and this product, while it was going on its way through, at a point to bring it to be industry ready, we collaborated with faculty from MSRIT. And so, in many ways, it's a first and a patent for Ramaiah Medical College. I request Chairman, sir, please accept.
Thank you, ma'am. Once again, many congratulations to the team, Dr. Ramesh, for an excellent achievement for all of us. Very proud for the Ramaiah Group institution. Thank you. Now we go to the formal vote of thanks. I request Dr. Sharin Mugi, madam, to please come on the dais.
At the continuation of this very informative afternoon, on behalf of Gokula Education Foundation and on my own behalf, I deem it an honor to propose the vote of thanks. I am very grateful and I give my heartfelt thanks to Dr. Gururaj for having spared and given time and presence here. I'm very thankful to our chairman, Dr. M.R. Jairam, for having come here and for having nurtured the dream of collaboration. And these are the first steps we are taking forward in collaboration. Thank you. I'm very grateful to Srinivas Murthy sir and Sri Ram Prasad sir for their presence here and for their constant encouragement. A deep sense of appreciation to Srivara sir and Sri Venugopal Shastri for having always encouraged us. Thank you for coming here. I'm very grateful to Sri V.N. Subramanian for being the hub which connects all the folks in this campus. Thank you for always being there. And our grateful thanks to Dr. Sri Atul Kapoor and his team and the team from GEF for supporting us during this endeavor. Our heartfelt thanks to our dear principal, Dr. Mehta Rao, and Dr. Harish, our associate dean, and our registrars, Dr. Pratap and Dr. Hemant, who could not be here today. But I thank them for always constantly motivating us to achieve greater heights. My sincere thanks to Dr. Krishnamurthy and Dr. Sundaresh, Dr. Sai Baba, Dr. Kadambi, and Sri Shekhar from Ramaiah University of Applied Sciences. I thank all of you and all the senior faculty and deans for the superb coordination in bringing out this
compendium. Big thank you to Dr. Nairji and the young RITFI team for their constant dedication towards the online training and for taking it forward with the government of Karnataka and also thinking of taking it forward in various other fields apart from COVID-19. Thank you. I thank DeepWorks, the organization that has coded this online training program. Thank you all. A special thank you to the team from University of Illinois, Chicago, as well as the team from University of Manitoba, Canada, and Brazil, Dr. Mark Barrow. Thank you. A big thank you to Dr. P. N. Razdan for his kind presence here and for always motivating us to achieve greater heights in the field of education, particularly medical education. Thank you. I am in awe of the collective wisdom and the collective expertise that is present in this room and online. I'm really grateful to all the heads of the institutions, as well as all the heads of departments and other faculty who have joined us either offline or online. Thank you very much for being with us on this very special day, and we look forward to collaborating with you more and more in the future. Thank you very much.
Request all of you to please join us for tea and coffee at the new cafeteria on the ground floor. Request